Thank you, Honourable Speaker. Unfortunately, this government's commitment to improve our healthcare system continues to fail. As evidence indicates, things have only become worse under the Canoe government over the past 18 months. There has now been 2 healthcare unions having to resort to striking, and the minister waited until the final hours in both instances to make only tentative agreements with the Canadian Union of Public Employees and the Manitoba Association of Healthcare Professionals. Does this supposed pro-union government feel tentative agreements at the final hour is the most effective way to fix healthcare?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, on this side of the House, we've been very clear. We respect healthcare workers and all of the incredible value they provide to Manitobans at the bedside. Which is why, when we came into government, the Premier was very clear that it's so important that we push employers to be at the collective bargaining table and get fair deals on the table for workers. That is in contrast to every member opposite who froze the wages of allied healthcare professionals for 2 terms of government. On this side of the House, we will always ensure that those negotiations happen. We want for all workers to be happy, healthy, and at the bedside of Manitobans.
The Honourable Member for Tyndall Park on a supplementary question.
Honourable Speaker, the Manitoba Association of Healthcare Professionals released a survey indicating 96% of allied health workers voted in strike. In addition, an alarming 59% of staff said morale has only gotten worse since this government was elected. I table a graphic from the Manitoba Association of Healthcare Professionals. Honourable Speaker, what is this government going to do to improve the morale that has continued to decline since this government came into power?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, we respect healthcare workers. On this side of the House, we have a belief fundamentally that they should be treated with respect and that we have to take care of the people who take care of us. That is something that has informed our listening tour. It's why we've invested in having more allied healthcare professionals on the front lines. Net 100 new healthcare workers, allied healthcare professionals at the bedsides of Manitobans. For 2 terms of a PC government, those healthcare workers had their wages frozen and their voices ignored. There are impacts as a result that our government is working very hard to repair. We're going to continue to respect them and work with them and listen to them as we make healthcare better by working together.
The Honourable Member for Tyndall Park on a final supplementary question.
Honourable Speaker, last month the MNU President Darlene Jackson said that there's very little transparency from the provincial government regarding the state of healthcare, and nurses aren't seeing any significant changes despite the NDP's plan to fix the system. Furthermore, Jason Linklater, the MAHCP president, stated 96% of workers voting to strike shows a profound level of disappointment. And what sticks out the most to me is it indicates a profound lack of trust. I table these quotes from the House. Honourable Speaker, after hearing these comments from union presidents, will this government acknowledge the concern about the lack of transparency since they've taken office?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, we have hundreds, almost 500 net new nurses on the front lines of our healthcare system, hundreds of net new allied healthcare professionals. We recognize that one of the most important things to change in the healthcare system to benefit healthcare workers is the culture. We also know that it takes time to change culture, and when you have a previous failed PC government that disrespected workers, fired them, froze their wages, and didn't care about listening to their voices, those efforts take time. But our government is committed to doing that work on behalf of Manitobans each and every day. We will put in tireless efforts to make sure we're moving healthcare in a better direction, which we're seeing. That member would be served well to ask the members on that side of the House why they treated healthcare workers with disdain for 7.5 years of government.